Olá, meu nome é Romualdo Barroso, sou médico oncologista, postdoc fellow no Dana-Farber Cancer Institute, e aqui conosco está a doutora Jennifer Ligibel, associate professor at Harvard Medical School, senior physician at Dana-Farber Cancer Institute, and the head of the Zenkin Center for Integrative Therapeutics. She will correct me, but Dr. Ligibel is a worldwide expert in lifestyle change and the impact of survivorship and this change in breast cancer. So we are very pleased to have her here in this symposium. So Dr. Ligibel, welcome here.
Thank you very much.
So there is a lot of research ongoing right now trying to evaluate the weight loss, lifestyle change, and breast cancer outcomes. But first of all, I'd like to ask you about what we know so far about weight, obesity, and the risk of breast cancer.
Sure, certainly. So there is a lot of evidence that suggests that women who are obese and somewhat women who are overweight after menopause have a higher risk of developing breast cancer. And some studies have suggested that that risk may be up to twice as high, although there's some variation in that. There's also evidence that suggests that women who do not exercise, and this is true for both younger women and older women, are at about 20 to 30% higher risk of developing breast cancer compared to women who exercise as a regular part of their lives. Now, the exercise does not need to be running a marathon. There are studies that really show that as long as women exercise 3 to 5 hours a week at a moderate intensity, doing something like walking, that seems to be tied to a lower risk of developing breast cancer in the first place.
Great. And the other very common question, especially for those women that were diagnosed with breast cancer, is how the fact that they were obese at the time of diagnosis impacts in their outcome. So what are the evidence linking obesity and breast cancer outcomes?
So there are, at this point, more than 100 studies which have looked at the connection between the weight that a woman is when she's diagnosed with breast cancer and her risk of developing a breast cancer recurrence, dying from breast cancer, or dying from other causes in the years after her diagnosis. The research suggests that women who are obese have about a 35% higher risk of dying from breast cancer and a 41% higher risk of dying from any cause, breast cancer, heart disease, anything, in the years after cancer diagnosis compared to women whose body weight is normal, in the normal range. There is also evidence, unlike the evidence looking at risk of breast cancer with weight, that the relationship between weight when a woman is diagnosed and her recurrence risk is elevated in both pre and in postmenopausal women who are obese. So it's a little bit different that weight seems to be a risk factor for poor outcomes in both older and younger women, whereas it's only a risk factor from what we know right now in older women for getting breast cancer in the first place.
Okay, so one important question is whether interventions can change this poor outcome. So I would like you to comment about the ongoing research and what are the recommendations so far that you usually do with your patients in your clinic.
Sure. So right now, we do not have any evidence from randomized trials that losing weight or exercising more will reduce the risk of breast cancer recurrence in a woman who's already been diagnosed. So we are conducting a large trial that will explore the effect of losing weight on the risk of breast cancer recurrence for women who are overweight or obese when they're diagnosed with breast cancer. The trial is called the Breast Cancer Weight Loss, or BWELL trial, and it's a study that's enrolling women right now in the United States and Canada. We are ultimately hoping to enroll more than 3,000 women who finished their standard breast cancer surgery, chemotherapy, radiation, and randomly assign them to a weight loss program plus a health education program, or to just health education, to see whether the weight loss program reduces the risk of cancer recurrence and death from breast cancer. It will be a while before we have the evidence from that trial. We opened this study a year ago. We've enrolled more than 800 women, so we're very excited about our progress to date. But it still takes a long time to really find results from big studies like that. So in the short term, we do have a lot of other information about the potential benefits of losing weight, of exercising more for people with breast cancer. There have been studies that have shown that women who are not exercising, that start an exercise program, have less fatigue. They feel less tired. There are studies that show that exercise can help reduce joint pain from aromatase inhibitors. There are studies that suggest that exercise can lower the risk of lymphedema. So there's a lot of benefits that we know will come to people that make these changes, even though we don't know yet about how this type of a program, weight loss or exercise, impacts the risk of cancer recurrence. So there are guidelines right now based on the level of information we have that suggest that breast cancer patients should try to keep their body weight in a normal range, or if they're overweight or obese, to lose a little bit of weight. There's not really data that suggests that you have to lose 50 pounds, but even just losing a modest amount of weight seems to be beneficial from a heart disease and diabetes perspective, and we hope from a cancer perspective. The guidelines also recommend that women exercise regularly, trying to do at least 3 hours a week of aerobic exercise and some strength training. And the guidelines also recommend that women try to eat a diet that has a lot of fruits and vegetables and whole grains, and not as much red meat and processed food and sweets. So I recommend those things to my patients. I think one of the things that's harder is, how do you help people actually do this? There is an ASCO, an American Society for Clinical Oncology initiative, to try to help oncologists talk to their patients about these things. So there are some tools that are available at the cancer.net site. I also try to figure out what's available in the local community. Are there exercise programs or dietitians that patients can work with to help them make these changes?
Great, thanks so much. And just taking advantage of your presence here, what are your thoughts about metformin and insulin resistance for patients with breast cancer? Do you have any recommendations right now about these two issues for your patients?
So there is very interesting evidence from population studies that shows that people without cancer that have higher insulin levels have a higher risk of developing breast cancer amongst some other cancers. And there are some data in women with newly diagnosed breast cancer who are not diabetic that having higher levels of insulin is linked to a higher risk of breast cancer recurrence. Now, higher levels of insulin also often go along with higher levels of blood sugar, of glucose, and that has also been linked to a higher risk of cancer recurrence. At this point, the information we have is primarily from this type of study, where we just note that there are higher levels of these factors and there's a higher level of recurrence in general. There was a large trial called the MA32 trial that enrolled women with early breast cancer who had finished their therapy and randomized them to metformin or placebo. We're still waiting for the results of that study, and I think that that will add some very interesting information. Metformin is a very unique drug in that it lowers insulin levels. It's a medication used to treat type 2 diabetes, but unlike most drugs in that category, which raise insulin levels to overcome insulin resistance, metformin actually lowers insulin levels because it prohibits glucose production in the liver. And so there's a lot of interest in this drug because of its ability to lower insulin levels. Until the results of that clinical trial are available, I would absolutely not recommend metformin outside of a clinical trial. There are side effects of the medicine. It can cause some GI issues for patients. And I don't think that we are at a place where I would recommend taking that outside of a trial. But I do await with interest the results of the MA32 trial, which hopefully will be available within the next few years.
Great. Thank you so much for your participation. I'm pretty sure that will be very informative for our clinicians. Thank you.